Okay, what's new in obesity? What are we going to do for our patients this year? So let's take a quick look at that. I don't have any disclosures. And the first question is, are we really obese? You know, we've been telling each other we're really kind of chubby and we really ought to get in better shape. And are we really there? Well, as of 2014, there's more obesity than underweight in the world. And that's good. So there are very fewer famines, there are fewer people who are starving, but they're getting pretty chubby. So 35% of the adult men and 40% of the adult women in the United States are obese. Uh-oh, and that's increased since last year. We seem to be going up. And unfortunately, almost 30% of the severely obese men and 18% of the severely obese women in the world live in the United States. Oh gosh, well, we knew that. We just didn't want to admit it. All right, there we go. So what can we do? These are the really kind of landmark studies for this year about obesity. And this is an interesting study that was just published in the JAMA. And what these people did was they got folks and they said, okay, we're going to give you two options here. One set of you is going to go over the dietitian. You're going to plan your food. You're going to be told what to eat and how many starches and so on and so forth. And you're going to try your best to follow. They said, yes, yes. The other group is going to be told, you need to eat 500 calories less. What they're going to do is we're going to keep your diary, your food diary, for about 2 weeks. We're going to see what you're eating. And we're going to say, that's it. You can eat whatever you want. But it has to be 500 calories less than you were eating before. Which group lost the most weight? The ones who said you can eat anything you want, but it has to be 500 calories less. And they lost about 10 kilograms more over the course of this study, 22 pounds, more than the people who tried to follow their food plan that was made for them by someone else. So the key here is your patients have to decide what they want to eat themselves, but you have to tell them to whack off a bunch of that. They'll probably do a bit better. Now, our dietitians do that. They ask the patient what they want to eat. We make up their food plan from what they want to eat, and then we whack off some calories. And that seems to work pretty well. If you give the patient a diet and say you've got to eat Brussels sprouts 3 times a week, it doesn't work well. We all could figure that out. Now, I have to make sure that she's gone. Yeah, she's gone. Okay. All right. Exercise helps, but not as much as caloric restriction, because it's hard to go out there and exercise. It's hard to get up and walk around on one foot. Really it is. And people don't do it as well. And so whacking off dessert, although it's difficult, seems to be easier for most people than actually walking the 2 or 3 miles that would be necessary to get rid of the calories from dessert, right? Right. You don't even have any yes cards. I can see all those nodding heads. So exercise is helpful, but mostly it just tells us that we're committed to something. And I exercise every day because I like it, but if I didn't, I wouldn't. And most of my patients don't, and so they won't. So then again, group sessions, what about them? Yes, interactive groups that are face-to-face, and they can be virtually face-to-face. There are apps, there's one obesity program in our area that actually you can Skype in and talk about your diet mayonnaise. So again, face-to-face seems to be better. It makes people more accountable, and having a buddy to walk with, a buddy to exercise with, to agonize with about not eating dessert at night, that seems to be helpful too, and about 9 to 10 times a year. Nobody wants these every week. No one even wants them every month. So that's what they found out in these 2 recent studies. Now, why are we obese? Oh, there's some new thoughts about that too. How about heredity? We know that, for example, Hispanic population, our black non-Hispanic population, higher percentage of obesity than Caucasians. And we are beginning to know why. It's your SNPs. Now, what are SNPs? They're little mutations. They're not anything that's going to get you right away. They're little things that predispose you to obesity. For example, we know in the Hispanic population, a number of them are born with a genetic deficiency that causes their insulin level to be higher when they're fasting. Now, is that a real problem? Oh, heck, not when you're 20. Not if you don't overeat, but if you overeat, and I'll have to tell you, the vast majority of us overeat, then you're unable to process that as well. There's another hereditary abnormality found in some sections of the black population where they don't store glycogen as well. So you eat your glucose, it isn't stored. So you have higher fasting glucose, higher glucose actually in your bloodstream all the time than someone who stores glycogen well. So what happens? Your insulin goes up. Does that make you sick? Well, no, not unless you overeat. So again, most of us overeat, and if we have one of these snippets, then we're going to be in trouble. So your snips can get you if you overeat. It's a good little rhyme you can remember. How about the environment? Oh, heck. We all know that obesity and diabetes are more prevalent in people in the lower economic class who can't walk around the streets because there are people selling drugs in the corners. We got that part. Thank you. But we know that built communities, where mostly the rich folks live, like Kiowa, where you can walk to the beach, people are in better shape. And the recommendation from the CDC is that we really need to have workplaces that promote exercise during the noon hour instead of munching all noon hour or sitting all noon hour and catching up on your dictation, right, as we all do. Maybe you can walk with your dragon hooked up to you and dictate your notes. But they suggest exercise in short bursts during the noon hour, during a break. If I had a break, I'd go to the toilet when I'm working. I don't think I'd exercise, but that's just me. Okay, the other thing that the English say is causing 50% of their diabetes and obesity are endocrine disrupting chemicals. I think we talked about those last year. There's a little more known about them, and actually they're like SERMs, you know, tamoxifen, selective estrogen receptor modulators, like tamoxifen. And you know that tamoxifen, for example, blocks the breast receptors. That's good. But sometimes these have an effect that's erratic. For example, tamoxifen stimulates the endometrium and can cause endometrial carcinoma. So again, some of these have good effects, but many of them have bad effects, and particularly the endocrine disrupting chemicals in our environment. Phthalates are a particular problem, and they are part of plastics. They keep plastics from being destroyed in the sun. But they're also very soluble. And so when you microwave your little plastic covered meal, of course none of you do that, you all cook from flour and water and whatever else you put in stuff. But I buy things that are frozen in little packages. And so when you microwave those, the phthalates come out. When you let your water bottle sit in the sun, the phthalates leach out. So when you drink warm bottled water, what do you get? A big drink of phthalates. And in childhood, if you do that, we know that those interfere with the mechanisms that stop the proliferation of adipocytes. So the key here is you get more fat cells if you drink water that you've heated in your plastic bottle in the sun. And who of us needs more fat cells? Where are these things? Well, they're all over, and they're stable, plastic stabilizers, so we see them all over. And in England, they're trying to eliminate these. If you go to Europe, we were there a bit ago, and you're hard put to find a plastic water bottle. They just don't want you to drink out of plastic water bottles. And the Scandinavian countries, you scour around, and you really don't see any plastic water bottles. So how to protect ourselves? Again, don't microwave things that come in plastic containers. Stouffer's has done a good job. They now put all of their foods in cardboard containers. You should be able to microwave those without getting some phthalates into your food. And carry your water in a bottle, either a container like with aluminum, or you can carry it in a container that's steel, or a container that's glass, but don't carry it in your plastic water bottle. And if you must use plastic water bottles, which most of us still do, be sure the number on the bottom, the recycle number, is low, a 1 or a 2. You don't want those really squishy ones that are 3, 6, and 7. They're going to give you more phthalates in your water. So where's the number? On the bottom. The other thing that's a problem are the polybrominated diphenyl ethers, and those are like thyroxine. And we know that people who are exposed to those have more hypothyroidism and more thyroiditis. And we know that from several studies in Japan. But you find those everywhere. They're in high-impact plastics. And because of that, they have gotten into the food supply. They're in your house dust. They're in the birds' eggs, and human milk. Isn't that frightening? Yes, we all have them on board. But again, that's one of the reasons we're seeing more hypothyroidism, particularly in the United States. And there is. Trust me, I make a buck on hypothyroidism, and it's more prevalent than it used to be. So they're everywhere. All of these endocrine disruptors are around us. And what can we do to avoid them? Well, just eat sensibly. If you don't have to buy everything organic, but organic foods are less likely to have these problems and the endocrine disruptors on board. Now, is it going to help us a whole lot if we put this in a paper cup? No. Because what is this anyway? It's a sugar-sweetened drink. And that's the environment inside. And that's us. And that, unfortunately, is the biggest contributor to our obesity. And as we can see here, when are you going to start cola? Well, you're going to start cola earlier. Obviously, you want this little kiddo to be taking a sip right there when they barely can select things. And that will mean that when they can select things, what are they going to select? They're going to select things like this because you've accustomed children to high fructose corn syrup, and when they are accustomed to it, they like it. It's sweet. By the way, where's the 8-ounce cup here? Oh dear, well, we don't have one. But again, what is this a big gulp of? High fructose corn syrup. And you say, oh, I heard that commercial. Sugar is sugar. Oh no, it's not. This is my little soapbox thing. This is 560 calories of high fructose corn syrup. Well, there's the 500 calories you could eliminate right there from your day. Again, high fructose corn syrup. The CDC suggests that we avoid products containing high fructose corn syrup. Now, why do they say that? Because the lobby for high fructose corn syrup didn't pay them enough? No. They're saying that because if we look at the American diet and what we have done between the 70s and the 2000 is that we have increased our intake of sweets, and most of that was high fructose corn syrup. Fructose is found in fruit in combination with glucose. If you have it in combination, it's not bad. If you have it as the predominant thing, it is metabolized in a different way. And I want to show you really the only human study that was any good. Let's put these all up. Okay, these were middle-aged or overweight obese adults. They're already obese. Okay, and so they were given 3 sugar-sweetened drinks with each meal, and this is a small study, but it was done very well and very scientifically. And so 15 in the glucose group, 17 in the fructose group. They ate everything else they wanted, and they both groups gained about 1.4 kilograms over the course of 10 weeks. Uh-oh, that's a lot a year. So if you continue to eat extra glucose or fructose, you're going to gain a bunch of weight. They also gained a bunch of fat. What do you do with your extra glucose and fructose? You store it as fat. Now, where did you store it as fat? See if I can get this to come up in color here. There we go. Well, if you were on the high fructose diet here in green, you stored it mostly as visceral fat. Uh-oh. What causes metabolic syndrome? What causes insulin resistance? What causes obesity and diabetes? Excesses of visceral fat. So visceral fat is where it's at. It's not subcutaneous fat that causes this so much. And if you use high fructose corn syrup, where do you store it? Well, you store it in the subcutaneous fat, but you store it also, lots of it, a much higher proportion in the visceral fat. So we now know that if you eat extra sugar, you get extra fat. We got that. But if you eat extra high fructose corn syrup, you store it as visceral fat. Ugh, bad, not good. And your insulin sensitivity, that's the bar down here. Uh-oh, insulin sensitivity. With the high glucose diet and the extra fat you got subcutaneously, your insulin sensitivity was plus minus preserved. Down here, you lost insulin sensitivity. So this is a very nice biochemical demonstration of the fact that the CDC is right. Now, this is the same CDC that told us that the reason we're overweight is we eat too much and we don't exercise enough. So there are days when it does better than other days, but this is a good one. So sugar-sweetened beverages, particularly those with high fructose corn syrup, lead to metabolic syndrome and diabetes. And we know that from several studies, including, this is a nice one in diabetes care as well. So the CDC says that the next target after tobacco is cola. How many of you drink cola? How many of you drink regular sodas? Okay, well, you're on the chopping block with the CDC. Let me tell you, they're going to get you. Okay, next thing we think of is the microbiome. And the microbiome, remember, we talked about this. Dr. Buck talked about this. The microbiome is the holy grail of disease, and your microorganisms on board actually contribute to a number of diseases and can help with a number of diseases, particularly obesity and aging. So let's take a look. You can meet your microbiome. Now, you may have thought your nose is a problem here, but it only has about 10 grams of autochthonous flora. They're mostly streptococcus. Now, if you want to talk about lots of microbes here, look at your gut. I mean, 1,000 grams. So the vast majority of your microbacteria live in your gut. And we'd like them to be Bacteroides, the good microbes. But look what you got in your gut. We've got some Proteobacteria. Those are okay. These are good. Uh-oh, these are not. Firmicutes. They did research on Firmicutes. They were looking at it because there are some people with short gut, and those people can't live. I mean, they literally are dying of starvation because their absorptive surface is low. So they looked at those people who are overweight, and they said, gosh, those people have more Firmicutes. And what they're trying to do now is to use Firmicutes to populate the guts of the people with short gut. Why would they do that? Because Firmicutes has enzymes that you can't even envision. They can break down insoluble fiber and get the carbohydrate out of it. So they help you get more calories out of what you're eating. Oh, thank you very much. That's what I need, more calories about all this stuff that I'm overeating. So again, when you have a high-fat diet and you have a high-sugar diet, you get more Firmicutes. And so they promote inflammation, they can promote insulin resistance, and they give you more calories out of what you're eating. Oh, yuck. I mean, we just don't need those. So, can you reset your microbiome? You bet. It changes within 24 hours of a new eating habit. So you're going to eat fast foods. What are you feeding when you eat fast foods? They're all sitting there waiting. You know, all the Bacteroides are saying, feed me, feed me. The Firmicutes is saying, oh, you always feed me. Right. So fast food, bad habits, you're feeding your Firmicutes. So try not to. Instead, you're going to eat whole grains, nuts, fruits, and vegetables, which will feed the Bacteroides and the Proteobacteria and the things you want. You're going to avoid unnecessary antibiotics because they can wipe out your good bacteria. Now, the question here is, you eat yogurt. My patients say, I'm going to take a probiotic. So I'm going to take a probiotic for breakfast. Yes, I'm going to populate my gut with some good stuff, some good bacteria. My microbiome will be just great. And I'm going to go out. You still got the Firmicutes there, but they're a little, they don't like yogurt, so they're kind of sitting there waiting. You go to McDonald's for lunch, right? What do you think that good probiotic that you did for breakfast did for you? Nothing. So you've got to just eat adequate foods because they're all sitting there waiting, and the bacteria that grow are the bacteria that you feed. It's as simple as that. Okay, this is a question here. What do fecal material and balloons have in common? I'm going to give you the answer because it's late in the meeting. They're both put into the stomach to decrease weight. Okay. Do you want to enroll in this study? This is an actual study. It's at the Mass General Hospital, and they're taking fecal material from thin people and putting it into pill form. They purify it a tad before they do that. And then they're going to they're going to divide the obese people into two sets, those that have the placebo and those that have the fecal material from the thin folks. And they're going to see if this causes weight loss. What do you think is going to happen? Well, you know, with any luck, you'd be in the placebo group if you signed up. They're getting cocoa pills. So this brings us to balloons. And this is the other new thing in obesity this year, the ReShape dual balloon. And there are two balloons that have just been approved by the FDA. They can be used for 6 months. They're put in with an endoscope, and they're filled with about 600 cc's of fluid, usually saline with some kind of dye. What's the dye for, you think? What happens if you get a hole in your balloon? Well, so if you get a hole in your balloon, you begin to see dye, and you're going to begin to see it in your urine and your fecal material, and they know there's something wrong with the balloon. They can go in and fish it out. There are a lot of people who cannot use this, people with inflammatory bowel disease, coagulopathy, psychiatric illness, gastric surgery, and so on. But when they put it in, the FDA approved this because the average person lost 14.3 pounds in 6 months. How much is that? Let's see. A little more than 2 pounds a month. How much do you think these cost? About $5,000 or $6,000. And I asked the GI lady I knew that does them. And the other one is the Barbera Intragastric balloon. Essentially same thing. It's 1 lumen, and they think it's less likely to erode the stomach than the 2 lumen balloon. Stay in place for 6 months. These people had an average weight loss of 22 pounds in 6 months. The average person on Put Your Money Where Your Mouth Is, it's an online site where you bet on how much weight you're going to lose over a given time. The average person on Put Your Money Where Your Mouth Is losing about 30 pounds in about 6 months and winning money. So I'll say, okay. So in summary, obesity is partly dependent on our genes and our exposure to toxic chemicals, but the bulk of the problem is that we consume large amounts of food that we shouldn't. We have high fructose sweetened beverages that feed the firm acutis, and we just get more visceral fat and change our gut flora. So unfortunately, there's no magic pill this year unless it's the fecal pill.